Go.
So next I'd be checking the abdomen. I would expose the area that I need to see. I would check to make sure it's symmetrical, check the umbilicus, making sure there's no bruising or any distension, it's midline. Also making sure in the during the inspection there's no masses, no distension, no abnormalities, no lesions, no bleeding. After inspecting it, ask the patient if he's been flatulating, or ask him if he's had regular bowel movements. After that, after inspecting and asking the patient the questions, I would then go to auscultating the abdominal area, starting from right lower to right upper to left lower. I'm not going to put them in so I can hear myself talk. When auscultating, I should listen 5 minutes per each section. And you want to auscultate the right lower quadrant first, because that's where the small intestine dumps into the large intestine. That's where the most noise will come from. So that's why we start here. So I would auscultate lower, upper, upper, lower. All right, for 5 minutes for each section. I would take off my stethoscope and I would lightly palpate each quadrant to feel if there's any distension or any pain. If there's any pain, I would ask the patient about the pain, PQRST, what makes it feel better, quality, radiation, severity, timing. And after light palpation, I do a little bit of a deeper palpation and seeing if I can feel anything. All right, if I don't feel anything, then I would then percuss each quadrant, seeing if I can feel any abnormalities with the organs. If I feel the organs, they should be a dull kind of sound. After checking the abdomen, I could then check the pulses on the inner part, the inner hip area. All right, there's pulses there. And then I would be moving down to the genitalia area, where I would be inspecting the vagina. I would ask the patient about if they had any pelvic pain, if they had usual menstrual cycles, if there's any, and I would also be smelling if there's a odd odor or see if there's any discharge, abnormal discharge. I would check the pubis area, seeing if there's any bruising or if there's any abnormalities, just make sure that they're not being sexually abused. Also seeing if there's any lice or any other crabs that might be parasites that are inside the pubis area. I would open up the labia to see that there's no crusted particles in there. Make sure it gets cleaned out. I would then ask the patient about their urination, asking if they're voiding or not. And if they are, is it painful? Is it discolored? Does it have an odd odor to it? It should be a straw yellow, no odor, and clear. After that, after checking the female genitalia part, I'm going to switch over to male genitalia. And for the male genitalia, I would also inspect the pubis area for crabs or lice. I would inspect the shaft of the penis, and if it's an uncircumcised penis, I would pull back the foreskin and check the area around there, making sure there's no redness, no swelling, making sure there's no infections happening on the penis itself, checking to see if there's any warts or any STDs that could be possibly forming on the genitalia. I'd also, again, ask the patient about urination, about the amount, the clarity, if they're actually going, at the smell and the odor. And then looking at the penis, I would check the scrotum, making sure it's not bruised or abrasions or any lesions. The scrotum should be slightly darker in color, and the left testicle is usually lower than the right one, so those are normal findings. And make sure that the area is clean. Also making sure that that there's no abnormal discharge that would indicate some sort of infection or an STD possibly. After doing that, I would go to the lower extremities. I would be inspecting the legs. I would see if they are normal skin color, making sure that there's no cuts, abrasions, deformities that are with the legs. I would feel for the dorsal pedis pulses and the posterior tibial pulses, seeing that they're both there. I then ask the patient to push on my hands, pushes, pull away good. And then I ask him which toe am I pinching so that I know that he can neurologically feel which toe I'm pinching. I'd also take my finger, run on the back side of his foot to make sure that there's a reflex. I would then pause for a second.